In my last video, I emphasized that once you are indicated for an emergency spinal surgery, without any further delay, you should select the right hospital and the right doctor to ensure the best outcome. You might select a highly qualified, highly skilled, and highly recommended doctor, but the reality is that no surgeon can give his best without proper facilities in his operation theater. If you go by just the name of a doctor without cross-checking the standard of your hospital, I guess you are making a mistake and you may end up regretting. There are 6 major factors which clearly influence outcome of a successful spine surgery. Number 1, spine surgery requires an exclusive operation table which is totally different from a standard one. This is a standard table, but it is not suitable for a spine surgery. Here is the right spine table, which is made of carbon fibers and is totally radiolucent, which means X-rays will not be blocked and images will be very clear. This table alone will reduce 50% of complications. Ironically, it costs 500,000 Saudi riyals. Spinal cord lies within spinal tunnel. The bone has to be cut to expose spinal cord and nerves. High-speed tools are necessary to do that job, and the tools cost around 250,000 Saudi riyals. The nerves are so small and hard to see by naked eye. An operating microscope will be very essential, which gives 10 times magnification, and it is much easier to handle the nerves and spinal cord without traumatizing unnecessarily. This microscope costs around 250,000 riyals. High resolution X-ray machine is absolutely mandatory to do a spinal surgery. Screw insertion into a very narrow bridge of bone carries about 15% risk of hitting spinal cord or nerves, which is phenomenally high and not acceptable at all. But then, there was no other option all these days, and we have been using this nearly for a century. The next generation X-ray machine is called O-arm, which gives 3D images like a CT scan. Screws can be placed very accurately, and the complication rate has dropped from 15% to 1.5%. The cost of this machine is 500,000 riyals. The latest addition is robotic, which has been slowly invading and replacing all manual surgeries in major hospitals, and soon it may become the only licensed treatment modality. Here, the surgeon is really the robot and the assistant is a doctor. A neurospinal robotic set costs about 5 million Saudi riyals. Whatever technology comes in, if you ask me whether a spinal surgery can be 100% successful, the answer is a big no. Why is that? No one knows. Human nervous system is a mystery and very little has been understood till date. We may use latest equipment and technology, may be performed by the best surgeon. Still, complications occur and no one will have any clue of why it happened. Until a few years ago, there was no technology to monitor functioning of spinal cord during surgery. But now we have it. Throughout spinal surgery, continuous monitoring of spinal cord and nerves has become a rule and standard practice these days. Any technical error during surgery can be picked up instantaneously and rectified. If all these tools and support are available, a spinal surgery can be assured for over 99% accuracy and outcome. I hope you got an idea about how important it is to choose the right hospital. For me, it is very easy to say, but for you, it may not be practical and you may not have that privilege to pick and choose. Here, everything is decided by your insurance card and its level of premium. You are forced to compromise and accept whatever is offered to you. However, this may be of some help to those who are health conscious and who can afford it. If you can afford, or if you have an insurance card which can uphold your demand, please choose the right hospital. If your insurance card is not strong enough to uphold your selection or cannot afford the cost, and if you are not satisfied with the quality of hospital, please consider taking a trip to your own home country and get the surgery done. Many people love their money more than their own health. For God's sake, this is definitely not the occasion where you should love your money over your health. The wrong side of the coin is complete paralysis and spending rest of your life in a wheelchair. If you need any assistance, please feel free to contact us on